this is a really great way to start with the shoulders. We're gonna take towards the wall both the alpha ball and the set of small balls. I wanna start with the chest, rolling the front of the chest. This is also super helpful to get into some of that mid-back strain. A lot of times we get kind of that side shoulder right at the edge and some of that upper back strain. It's because we're being pulled forward. And I'm sure all of us are working a little bit more on a computer, not maybe in as good of positions. So we've probably been a little bit more slumped. So that can contribute with some shoulder impingement, which usually presents right at the outside of the shoulder. And that also can present with that mid-back kind of strain and heaviness and pull because our muscles are working harder to keep us up. So let's start at the wall with the alpha ball. We're gonna come right under the collarbone and we're gonna go across the front of the chest out towards the shoulder. Just working the upper pec, just exploring to begin. So let's give that a try. I'll take this off so that you can see better. And you're just gonna lean in and let the feet come away from the wall just a little bit so that you can lean in with your weight towards the wall. And this is a pretty sensitive area. So maybe you don't even do much movement. Maybe you just take a few deep breaths, starting towards the inner third of the clavicle, then moving out towards the middle third, underneath the clavicle, not on the bony point itself. And then out to the side, to right towards the front of the shoulder joint. And then you can sweep across, even all the way out so that you roll over the front of the ball of the shoulder. And I get a little bit of a tender spot when I get out here. So if you come to a point of tenderness, see if you can just welcome that tenderness and soften into it, soften around it rather than tightening up. Maybe you let your head rest on the wall. And then when that sensation subsides, you can go back to the sweeping, finding that next point of sensation, whether it's underneath the clavicle, or maybe it's around the edges of the acromion, so the ends of the clavicle that forms the cap of the shoulder. So wherever you arrive in sensation, just meet it there. And then maybe you change the direction of your roll a little bit, getting more into the pec. You can do a little up and down, a little squat or a little chug of your legs so that you start to zigzag across the pectoral now, staying lateral outside of the chest bone, feeling into the more muscular part of the chest. Maybe going up and down, maybe going side to side. So now you're in about the first 3 ribs. So just underneath the clavicle now with that zigzag, you'll get into the pectoral minor, pectoralis minor, which attaches right into the shoulder girdle. It can pull that shoulder girdle into an anterior or forward tipped position when it's tight. So that's going to be probably about 2/3 of the way out, still in the rib cage. And it runs on a little diagonal, like a 45 degree. So you might just pause there and use your breath to mobilize. Soften the pressure if you're feeling any numbness, any tingling, any loss of sensation. I want you to stay out of the brachial plexus. So stay away from nerve compression, which all runs through this area. So this will also help if you have any carpal tunnel type symptoms, any tennis elbow type symptoms. Starting here will address the whole arm. Take about 2 or 3 more breaths along here. And then release. Just let the arms hang. Get your feet back under you. And then let's progress to the other side. So starting right where the collarbone and the sternum meet, underneath the collarbone, you'll roll out to the side. Just observing what this body is giving to you. So meeting the sensations, welcoming the sensations so that there's less fighting and more sensing, more observing. This is a practice of inquiry into the sensations of our body. So it gives you improved awareness, or proprioception, which is awareness in space and awareness of how we move. Working your way along the bottom edge of the collarbone. Pausing and noticing as you arrive at a sensational spot, maybe just sustaining that compression until the sensation softens. You may even note some sensations if you're on the rib. You may even note some sensation that kind of radiates around into the upper back. We'll get into that a little bit later. You can come all the way out to the front of the shoulder, right into the front part of the ball of the shoulder. And notice how this side feels really different probably than the other side. For me, the right shoulder was really tender. And I'm not getting that same tenderness on the left. So just observe without trying to analyze it. But maybe you'll start to realize patterns that you have in your body. Like, oh, the right shoulder was more forward. The right shoulder must be more forward. I must use that more, lean into that side more. And as you do this work, you'll start to learn more about the patterns of your body. And also notice if you get any sensations down the arm, try to stay out of any numbness, any tingling, any radiating pain. And then start to come down into the upper ribs, top 3 or 4 ribs, staying well above the nipple line, and zigzagging across the top rib, feeling into the meaty pec minor muscle that's going to run on a diagonal towards the shoulder. That pulls the shoulder into a forward tipping action. So we're trying to free that up right now. Taking about 3 to 5 more breaths to just explore, traversing across the front of the chest, pausing and noticing where you feel points of sensation, softening into that sensation, welcoming it and allowing it to soften under the work of the breath, using your breath as a driver. And then release. Coming away from the ball, maybe doing a few shoulder rolls, noticing if you feel a little different. And then you can stick with the alpha ball if you like, but I'm gonna come to the standard size therapy balls in the tote for the next roll. This is the last exercise we'll do in standing, and then we'll bring it down to the floor for the rest. So here, we're gonna roll over that cap of the shoulder, so the deltoid area. And this is the most common referral point for anything going on in the shoulder joint. So if you're getting any impingement because these other muscles are tight and the shoulder girdle's not moving well, oftentimes it will present here, but a lot of times it's the more postural muscles that are playing more of a role, which is why we started with the pecs. But we'll get over that cap of the deltoid by rolling along the side, rolling along the front, and rolling along the back of that cap. Of the cap of the shoulder, sorry. So I'll start facing you so you can see me to begin. And you're gonna just lean into the wall, begin right at the edge of the shoulder, and it's just gonna be a little up and down. That's gonna bring you along that shoulder cap. And if the rotator cuff muscles are weak with this, this oftentimes is overused. We'll use those kind of bigger, bulkier muscles. So the goal is to get out of some of these and then into more of the positional and postural muscles. And then about a third of the way down the upper arm is right where that muscle attaches. So you might find kind of like a marble type or tack type feeling under the ball. And I'm just gonna kind of rock. So now I'm gonna go across that. I'm just moving my body over the ball. That's what feels right. So if the kind of scrubbing up and down, stripping the muscle feels good, stay with that. But I just found the spot and I'm like, I can really get around that spot by rolling over it. Really make sure that bottom arm, the arm you're rolling, is hanging heavy towards the floor. And then now rotate away from the wall a little bit so that you get the back cap of the shoulder. And then now rotate towards the wall so that you get the front aspect of that cap. So you lean in on an angle. And again, let the legs do the work. So you're just moving the trunk up and down a little bit. Bottom arm, the arm you're rolling, is really heavy. And then relax. Switching to the other side. I'm going to be facing away from you now. So first, the side of the cap, then the back, then the front. About maybe 3 minutes total here. So begin just by stripping up and down. And then if you find a spot of sensation, pausing, maybe rocking forward and back, rotating over it. So now that's a little cross friction. Rolling arm really heavy, letting the trunk and body do all the work. And then rotating away just a little bit, angling away from the wall so that you can get the back cap of the shoulder, even the back of the rotator cuff a little bit. You might get infraspinatus attachment here a little. You may even get the teres. Those are all teres minor, teres major. Those are all rotational motion muscles of the shoulder, all part of the rotator cuff. So if you find a spot of sensation, maybe pausing, kind of shake that arm a little bit just to soften it. Taking about 5 more breaths or so, just to finish exploring that shoulder cap. And then removing the balls, coming away from the wall. And let's go right down to the floor. So a big foundation of the shoulder is the thoracic spine. So the shoulder blades sit on the thoracic spine, and the shoulder blades really are what determine the position of the shoulders. So for the foundation really of it all is the thoracic spine. So let's get into the mid-back a little bit. We're gonna start with the balls right at the lower thoracic spine, beneath the bra strap level. So you're probably in the last 3 or 4 segments of the rib cage, and you'll find that just right spot. So lie onto your back, and then make sure right here you have your foam roller or your Coregeous ball nearby. Either work, they work exactly the same way. The foam roller is actually a little bit more stable. If the Coregeous ball is soft, it's a little less stable for the low back, but either work well. Foam roller or Coregeous ball kind of at your side. So now, lie onto your back, and you'll find, oh, this is pretty sensational right here. So I just want you to arrive and find that just right spot beneath the bra strap line, lower rib cage, one ball on each side of the spine, and then allow the shoulders to just fall back towards the floor. And now take a few deep breaths, just seeing if you can empty the rib cage, allowing the ribs to just drop towards the balls. If you notice the chin going way up towards the sky, see if you can pull the chin towards the chest a little bit. You may even take your hands to give a little traction through the neck to lengthen out the upper back above the level of the balls. And now, I want to use the trunk to get a little bit of mobility here in the rib cage. So, watch my hips. Hips tip down towards the heels, arching the low back. Then hips tip back towards the head, flattening the low back. Tip down, tip back. And notice how the head sort of follows the hips. And notice how you massage through 2 or 3 segments of the lower back here. We're getting right into the diaphragm, which is the best way to address the position and mobility of the rib cage. And then find stillness. Again, lengthen the neck if the chin starts to arch up. And now take your right knee to your chest. Hug the right knee into your chest. Doesn't have to be really hard. Just give it a good hug. Think about dropping the knee towards the floor. You don't have to pull it really hard towards the shoulder. It's more like you want the knee to go down towards the floor, right to where the ball meets the body. And take 5 deep breaths here. As the body relaxes into the sensation, maybe you straighten out the left leg. And feel how the front of the left leg begins to open. So you feel a little opening in the hip flexor, and you can exaggerate that a little bit by reaching through the left heel here. And then hug both knees into your chest, pressing both knees down towards the floor, hugging the knees towards the lower ribs. Breathe into the back seam of the body. With each exhale, feeling the breath along the spine. And with each exhale, feeling a sinking into the balls. And as you're ready, right foot comes to the floor first, keeping the right knee bent to begin. And then as you're ready, maybe the right leg straightens if it feels okay in the body, reaching through the right heel, feeling an opening in the front of the right hip. Watch the chin. You may notice the chin comes way up towards the sky. If you can, try to lengthen the back of the neck by tucking towards the throat. And then again, hug both knees to the chest. Maybe even gently rocking over the balls just a little bit side to side. And the knees return to the earth. And now take the hips high. Balls will start right where they are. So you don't have to move them unless you feel like you need to readjust them because they're a little crooked or not straddling the spine. But Coregeous ball or foam roller now comes right under the pelvis. So your whole sacrum and tailbone are resting on the Coregeous ball or the foam roller. Now take your arms, hug your arms so that you're reaching for the inside border of the opposite shoulder blades. And now you'll start to make your way up the thoracic spine. So you're going to start to roll along the middle of the back. And then as you walk down, you may have to reposition the Coregeous ball a little lower. I actually think I prefer the foam roller here if you have one, because it is a little bit more stable and it is a little firmer. But anything will do. You can even do it without anything, but I like having a little extra support. And then if you find a spot of sensation, maybe take a deep breath and just allow yourself to drop over the balls. You may even find that you get a little self-manipulation or self-cavitation in those places between the shoulder blade. And so now you're really exploring that space between the shoulder blades. The hips elevate on the ball are going to make the movement just a little bit easier. So you can glide a little smoother. And it's also going to put a little bit more weight into the balls. And it allows the head to stay closer to the earth, to be a bit more supported and relaxed. And then as you find a space of sensation between the shoulder blades, I want to emphasize improving that mobility in those segments. So take your hips off the ball for a moment, and then bring your hands to clasp behind the neck. So you're interlacing your hands, bringing them behind the neck. The pinky fingers kind of push up into the occiput of the head. And this is a good thing to find because we'll end with this roll. So now, Press the elbows wide so that you can touch the floor if possible with the elbows. Arch the back so that you stick the tail out. Now, do the pelvic tilt to flatten the low back. Elbows draw together and then round up. So we're moving between extension of the spine and then flexion of the spine. It looks like a crunch, but it's more about hollowing out so that you move and mobilize the spine. And then maybe you have to move up or down a segment so that you're creating a lever over a different level of the spine. Try a few more rounds. And then as you feel ready, like that space between the shoulder blades is moving well, remove the balls and lie flat on your back. Even let the legs come out for a moment and find a second of rest. Now, let's come back to some shoulder motion. Take your balls out of the tote. Bring one ball to the inside of each shoulder blade. Lie on your back, same place you were just in. Find that just right spot. Maybe you have to slide up or down a little bit. And now we'll work on the shoulder blades moving on the rib cage. We just worked on the movement of the rib cage. Now we'll work on the shoulder blades moving on the rib cage and incorporating shoulder flossing into that. So begin, same thing. Lengthen the back of the head. If you're feeling like the back of the head can't touch the floor or needs some support, maybe you put your gorgeous ball there. Or maybe you put a blanket or a towel, something to allow the back of the head to lengthen right there, to make you feel supported and at ease. And then now come back to the shoulder blade motion, shrugging the shoulders, bringing the shoulders down. Shrugging the shoulders, bringing the shoulders down. Inhale up, exhale down. Inhale up. Exhale down, up and down, up and down. Last time. Now arms come up towards the sky. Now the hands reach towards the sky. And then the shoulder blades come back toward the floor. So it's still up and down, but now it's up towards the sky, down towards the floor, and you'll feel the shoulder blades roll over and around the therapy balls. Shoulder blades push apart, spread the upper back, and then drop the shoulder blades back along the rib cage. And down, and down. And now arms start to become part of the motion. So inhale, arms reach in opposite direction like a scissor. One down towards your heel, one up overhead. Stretch in opposite directions as long as you can. Deep breath in. Exhale, arms float up and switch all the way. Inhale, reach in opposite directions. And then exhale, switch all the way. Inhale, opposite directions. And then inhale. And again.
Couple more. Letting the arms float up on the exhale. The activation is as you reach in opposite ways, stretching long, breathing in, and then moving and switching on the exhale. One more time in each direction. And then arms both float down by your sides. Arms now make snow angels on the floor. So, arms sweep up and then sweep down. Elbows can bend a little bit as you come up overhead so that you're careful not to hyperextend your elbows. Make sure you have enough room so they can rest on the floor as long as possible and move smoothly. If you find a clunky part in that range, maybe focus there. Maybe pause there and do a little arc. Because if it's clunky on here, that's probably where you're getting stuck. And that might be causing some impingement symptoms in the shoulder. Or it might be causing inappropriate mechanics that cause strain. So see if you can floss the shoulders. You can go through partial range, like reach up overhead and then pull both arms down kind of towards a field goal position, almost like a lat pull down action here. Whatever part of that circular range feels good, give that a try. You may even find that it feels good to circle and cross your chest and come all the way down. So the arms maybe even circle up and cross on the way down across your chest, or maybe they come up the middle and try big circles. Whatever you're doing, smooth out that motion all along the inside border of the shoulder blades. Listen to your body, maybe move up or down a couple segments. Freeing up the foundation of the shoulders. Three more passes wherever you are, or just find stillness, pausing, breathing into the sensation, letting the body soften, relax. And then let the arms come down, roll off of the ball by rolling to your side, come flat onto your back, and relax all the way. Feeling how you really sink into the floor now. So just like the shoulders, the hips should have that really beautiful circular free motion. And that isn't often the case. So we're going to get that same type of integration now in the hips. So take a single therapy ball. I'm going to do my left hip first just because it's closer to you, but you can do either side, whatever feels more natural. So take that therapy ball right into the middle of your gluteal. Bend both knees here. And now, let's just straighten out the leg that has the ball behind it. And now squeeze that glute really good so that you push the ball out. And then relax and sink into the ball. Let's do that 2 more times. So just using a contract, relax to help the glutes let go, squeezing and holding about 7 seconds. getting a good contraction, and then sinking in. And I personally, you can use the standard size, the plus size, the alpha size, whatever you like. I prefer the smallest size for me because I feel like it allows my pelvis to stay as neutral as possible so that I don't get any funky SI joint things. I can really just get into the muscle without throwing my pelvis off. Once I relax the glute, you'll find that the hips are pretty level here. So now what we're going to do, we're going to turn the leg out to the side from the hip without letting the pelvis move. So your hands can monitor the pelvis. Then you're going to slide the leg up almost like a reverse breaststroke out to the side. Now circle the knee in towards midline. Here you'll get some nice sensation right through those hip rotators. And then straighten the leg back out. Turn from the hip. Bring it out to the side. Slide it up the floor. Bring it back to midline. And then down again. Let's do 3 more circles. Almost like a reverse breaststroke action. And a lot of times when we get pain on the side of the hip, it's because our glute muscles actually aren't working too well to stabilize us because we have poor separation of movements. We don't have great awareness of how the ball of the hip moves separately from the pelvis. So see if you can really focus with all your awareness on just the ball of the hip moving inside the joint. Now, let's try to reverse that motion. So now with the knee bent, whenever you get there, let your knee fall out to the side, circle down, come back to center, and then come up the middle. Knee falls out to the side without the back and pelvis going, just the ball inside the socket. Keep it turned out, straighten, come back to center. Let's do 3 more circles. 2 more. Making sure you circled in both directions. And then the next time the leg bends, let your knee fall out to the side. Maybe I feel like I have to adjust the ball just a little bit. That place that I was in really softens. Now I'm like, okay, I need to find that next spot. So now I have the ball in a good sensational spot under my glutes. Now I'm letting the left knee fall out to the side. Now I'm going to start to rotate the hips to the right. So now my pelvis and back are moving. I'm swinging my hips like I'm on a swing to the right. So I move out to the back of the left hip, out towards that bony area in the side of the hip. And then I'm swinging back to center. Swinging out. Swinging back. Breathing. Always feeling where the body and the ball meet. Bringing all your awareness there. Using your breath to soften, to meet that sensation. Maybe pausing, finding stillness at some point along the line. The left knee or the bent knee that you're rolling, the side you're rolling, might even come down to the ground, and you might find that you just roll onto the outside of your hip. Now once you're here, kind of on the outside of the hip with the ball in that outside hip area, right at the back of the circle, that bony circle on the side of your hip. So right at the insertion point for all the hip rotators, see if you can push the knee down to the floor and squeeze your butt so that you're engaging now the hip rotators. You might even feel a cramping in the hip a bit. And then release and soften in. Maybe sweep again to find that just right spot, landing right at the edge of the greater trochanter where the hip rotators attach. Push the knee into the ground, squeeze your buttocks so that the leg that you're rolling is pushing into the floor, the knee, the shin, the foot. You're squeezing your behind, maybe even pushing yourself up a little bit. And then release. Breathe and soften. Notice if anything else is working in the body. Notice if the jaw is tightening. Notice if the eyes are really gazing hard. Soften the eyes, maybe even close the eyelids. Relax the jaw. Maybe even take your fingers and just kind of rub the jaw for a minute. Notice if you're clenching your teeth. The jaw and the hip are super closely connected. So make sure the teeth and the lips are parted, and do one more time. Contract, squeeze your butt, push the knee into the floor. See if you can get all of those muscle fibers to come online, to activate. And then relax. Let the right hip come down. Pull the left knee back to midline. Take the balls out. Relax both legs long. And just notice the difference in the hips. Whole body supported on the floor. Now let's try the other side. Bending both knees. Now I'm moving to my right side. So staying on my back, both knees bent. Ball comes underneath my right glute. To begin, my right leg straightens. And if you're on the other side, totally fine. And just settle in. Notice that place of contact between the body and the ball. And see what happens there. You may find that the body automatically clenches because of that sensation a little bit. So see if you can soften into it, just meet that sensation. And then we'll actually use the contraction to relax a little bit more. So squeeze your butt, activate all the glute musculature, squeeze, 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 and then release. Let's do that 2 more times, squeezing and holding about 7 seconds, engaging all the fibers of the glute muscles, getting them to turn online. So we're using contract, relax to get them to fire up. So you might feel a better contraction the second time, and then you might feel even a better relaxation. And then one more round. Squeeze. Hold for 3. Get all those fibers firing. 2. Last time. And then release. Now, rotating the toes in and out. Turn the hip into internal and external rotation. So moving the foot from movement at the hip, at the ball inside the socket joint. And now with the toes turned out to the side, with your pelvis lying flat, maybe take your hands to the pelvic bowl. Bend the right knee out to the side like a frog leg, a reverse breaststroke. Pull the knee into midline and then allow it to straighten back out. So making a big hip circle, keeping the foot supported on the earth so that you're not kicking in the hip flexor to pull the leg in, so that you're just dragging the leg up to the side, Pulling the knee into midline, foot on the floor, then sliding it back down. Out, bend, midline, down. Do one more in this way, then change directions. So as you're ready, the knee falls out to the side without pulling the pelvis. Then it straightens out. Now come back up the center midline. So leg is straight as it comes up, as it bends up the center. Knee goes out. Leg stays turned out as you straighten. Center and up. Out. Straighten. Center and up. Out. Straighten. Center and up. One more. Out. Straighten. And up. Beautiful. Now let the right knee fall out to the side. Maybe reposition your ball. And now we'll start to sweep along the back of the hip from the edge of the sacrum out towards the back of the hip bone. Pausing along the path. If you notice a place of sensation, maybe you just pause and stay there. Sustained compression is just as good as any other technique, if not sometimes better, because it makes you just pause. It makes you notice, and it allows the body time to soften into the sensation rather than trying to be active or moving through sensation. When we slow down, when we pause and notice, then sometimes our body lets us in even more if we just listen. So wherever you are, roll towards the right now so that the ball is about where the back of the hip bone is. So you have the lateral, your greater trochanter, that bony point at the side of the hip. So you're right along the back of that where all the hip rotator muscles are attaching. See if you can soften into the sensation of the ball. Take a few deep feeling breaths, sending your breath all the way to where the ball and the body meet. Now one more time, using the musculature to release the back of the hip, the side of the hip. So push your knee, push your lower leg, push your foot into the floor, and then squeeze the buttocks on the side that you're rolling. For me, it's the right side. Hold it for 5. Keep pushing the leg down. Keep squeezing the glute for 4, 3. Keep squeezing for 2, 1, and then release. And then maybe after you sink down in a little bit more along that back bony ridge, that attachment for the hip rotators, you might move the ball slightly, or it might just be just right. And then again, push the leg down. The key is to push the outside of the leg of the floor down and squeeze the butt so that you really activate the hip rotator muscles. This is so critical, activation of the hip rotators in clearing the side of the hip, in stabilizing the side of the hip so that we don't get a rubbing, which will cause inflammation or bursitis in that outside area of the hip. And then release. One more time. Squeeze. Hold. Push the leg down for 5, 4, 3, 2, 1, and then release. Remove the ball. Let the legs come down. Take your therapy balls back into the tote. And you can either use the therapy balls on a little blanket or a little block, and they'll go behind the head. And you'll just get a nice occipital release. If this isn't accessible to you, I know many of you have the alpha ball. This is also really beautiful. You can place this right at the base of the head where we had our hands, and it gives a little traction. We're going to do one stretch while we get a nice suboccipital release. So bend both knees. Take your legs towards a figure 4 position, pushing the left foot over the right knee, pushing the left knee away. Now start to rotate the legs over towards the right so that you start to come into a rotational stretch. Rotating, and you're even getting a little suboccipital massage. So we're getting back into that shoulder, integrating that shoulder area by getting right to where the traps meet the base of the head and getting into the outer hip. And then the next time the legs rotate over to the right, get the right foot to touch the floor. The left foot to touch the floor, and then push the left knee away so that you activate the left leg, and you'll start to feel a little bit more stretch. Hold that for 3, 2, 1, and then release. We'll do that 2 more times. Push the knee away. You may even feel the left hip drive forward. Keep the shoulders down on the floor. Keep the head relaxed. And then release. Last time. Pushing the left knee away into that rotational stretch. You may even feel the ribs lift up a little bit, but keep the shoulder blade down. Keep the chin down, back of the head supported, head really heavy, and then release. Bring the legs back to center. Maybe rotate side to side just a little bit, resettling the SI joint and the sacrum. And then switching sides. Cross the right foot over the left knee, and then start to rock your right foot towards the left. You'll do it a few times back and forth, pushing the left knee down towards the floor and holding the right leg with it until your right foot meets the floor. And then once you get there, pause. Left outer leg towards the floor, right foot towards the floor. Reposition the ball if it's not in that just right spot supporting the head. If this is too much with the ball, the foam roller is perfect here, or the Coregeous ball is perfect here. Whatever you need to get just a little traction of the head off of the top of the neck. And then push the right knee away. So right knee pushes down towards the left foot. Hold. You may even start to feel the right hip being pulled over to the left. And then release. Keep both shoulders and shoulder blades open and on the floor, feeling the chest opening. Push again with the right knee, pushing it away. 5, 4, 3, 2, 1. Pulling the hip over and then release. Last time, maybe even feeling the ribs lift up a bit as the right shoulder blade stays grounded. Feel the right ribs move, lower ribs move to the left as you push the right knee away for 5, 4, 3, 2, 1, and then release. Come back to center, remove every single prop, and allow yourself to come all the way down to the floor. Melting entirely into the support of the earth. Let go of any last bit of efforting. Feel the heels heavy. Feel the calves heavy. Soften the kneecaps, the tops of the thighs, the buttocks, the abdomen, the rib cage, the shoulder blades, the shoulders, arms and hands, neck, jaw, eyes, head, whole front of the body relaxed, supported and at ease. Whole back of the body, heavy, supported, relaxed and at ease. The entire body supported, at ease, completely relaxed, spacious, and open. And as you're ready, taking as much time as you need, without rushing or efforting, roll to your side, pause. Push your hands into the earth, pushing down to rise up. And then coming together and sitting. Bring your hands to a gesture of gratitude. Grateful for our bodies and for our practice. That through this work, we can breathe deeper, move freer, live more fully to do our work in this world. Namaste.